Hello everyone, my name is Sabrina Garland. I am currently a student at Kaiser University and I will be presenting my project on the biopsychosocial model review of cancer. Metastatic cancer is a devastating diagnosis that affects many aspects of the biopsychosocial model. This model analyzes the interactions between biology, psychology, and social cultural factors that could modify behavior. The purpose of this presentation is to show how this model relates to cancer and regarding the diagnosis and treatment of the disease. Each component of the biopsychosocial model will be broken down by the three primary components: biological, psychological, and social. Biological associations with cancer. I would like to take a moment and look at the image on the right-hand side. This is a thermographic image of a woman with breast cancer. The top baseline reading shows no presence of the disease. As you can see further down, you have a progression from 3 months to 12 months. The red that you see growing on the right-hand side of this woman's breast is the cancer. The redness is caused by the heat that we are seeing. It is primarily caused by the inflammation. Physical health and symptoms. According to the Center of Disease Control, cancer is a metastatic disease that occurs due to the mutation of a healthy cell that begins to grow and divide at an uncontrollable rate. Common symptoms would include the presence of a visual tumor, heat or inflammation as presented by the prior image of the woman with her thermographic imaging, and instances of fatigue. Symptoms may vary depending on the location of the body being affected by the disease. For instance, someone with lung cancer would experience symptoms of dyspnea or difficulty breathing and even chest pain. Also, many of the symptoms thought to be in correlation to cancer may actually be caused by the conventional treatment methods. These methods would include chemotherapy, radiation, and surgery. In chemotherapy, you are not only targeting the cancer cells, you are affecting the entire area presented. So that means all the healthy cells within that area are also going to be targeted by the chemotherapy and have a chance of dying off, which will deplete the immune system, which will cause that hair loss, vomiting, nausea. Here we go with stress and cancer. Emotions have the ability to impact physical and mental health. In some instances, emotions can even manifest on the body in a physical form of a disease. This is evident through cardiovascular disease. Typically with cardiovascular disease, we can see that a patient can have this develop through constant activation of the stress response system or instances of depression or anger. That causes vasoconstriction in the body, causes your heart to beat a little faster, and could even raise your blood pressure. Constant activation of the stress response system, commonly known as the flight or fight response, can disrupt many of the body systems as well. This would include the digestive, immune, cardiovascular, and reproductive. Chronic stress and depression have been found to create inflammation that could impact cardiovascular health. The effects of inflammation. What is inflammation? Inflammation refers to the body's immune response process of fighting against harmful pathogens and toxins, commonly characterized by the sensation of heat to the touch or redness. This is bringing back evidence to that first image of the thermography where we saw that heat was actually presented in that image. According to Candido and Hangman, there are instances where inflammatory conditions precede the development of malignant cancer. During malignancy, inflammation aids in the proliferation and survival of cancer cells and decreases the immune system. This is simply stating that inflammation helps to proliferate, which is bring to life, and helps the survival of the cancer cells. It helps them reproduce and spread throughout the body. It is evident that inflammatory microenvironments are essential components of all cancerous tumors. This environment of inflammation and heat is needed for the progression and development of a tumor. Genetic disposition to cancer. Evidence has suggested that there is a genetic link for the presence of breast and ovarian cancer. Mutations in the BRCA1 and BRCA2 gene can be used by physicians to identify individuals who may be at higher risk for the development of breast and ovarian cancer. Information at this point is key to the prevention and early treatment of cancer. According to Lynch, most women reported that if testing identified them as a carrier of the gene mutation that we've mentioned, the BRCA1 and BRCA2, then they would be more inclined to consider a lifelong surveillance of their health and take preventative measures against the development of cancer. Psychological impact of cancer. The initial diagnosis of cancer can be very scary and difficult to face. Having high self-esteem has been shown to help during the post-treatment of the disease by providing a positive outlook and increasing individual self-worth. High self-esteem is a buffering agent against the distress associated with the diagnosis and treatment of cancer. By buffering agent, this is referring to the fact that having high self-esteem gives you a little bit of leeway against these negative emotions and the negative diagnosis of the cancer. Self-esteem continued, the impact of increased age. Older patients aged 60 and up are the fastest growing segment population of the United States. This can be attributed to the advances in modern technology and medicine. Individuals within this segment are already exhibiting physiological decline due to their advanced age. A growing prominent concern associated with this population is the challenge of managing health issues such as cancer. Other health issues would be diabetes and cardiovascular. Oncologists must keep in mind that if they are dealing with a patient who falls into this category, they may be experiencing more instances of fatigue and pain and depression than someone in the younger category. Depression becomes more evident in older adults in comparison to the younger generation. Depression. Cancer is associated with many negative emotions, including depression. Depression correlates to poor self-esteem, decision-making, and diet. When depressed, individuals are more likely to engage in careless or unhealthy behavior. This would include picking unhealthy foods to eat, making poor decisions in regard to their health. Should they get up and take a walk or sit on the couch and watch TV all day? There are instances where depressed older adults opt for no treatment at all. This is based on the belief that their life has been lived and that is just their time. This can also be due to the self-fulfilling prophecy. For instance, a smoker developing lung cancer may believe that at this point in time they knew it was coming and that they have the cancer now, it was going to happen. They may not opt for treatment, or they may just go a traditional route and do chemotherapy, radiation. They most likely will not feel regret or make the psychological shift necessary to progress and growth. Social support and impact of cancer. Support of family and friends. Research has suggested that the inclusion of social support via friends and family is essential for an emotion buffer when facing a cancer diagnosis. As previously mentioned, the buffer is the same thing that we talked about with self-esteem. This buffer is going to help patients see the brighter side of a situation. The application of social support provides an external motivational factor for the continuation of treatment. This may, as previously mentioned, the support may be lacking due to natural age progression. By that, what I'm speaking about is as a person ages, they start to lose family members. They lose their mom, their father. They may start losing close friends once they start hitting 65 and up. The lack of that social support could be devastating on a person's health. According to Dunkel, Shedder, individuals who receive social support express decreased levels of depression, anxiety, and also found that those who received consistent positive support had a better outcome than those who did not. Formation of a non-acidic environment. Cancer has a tendency to thrive in an acidic environment. This would include what we eat, drink, and feel. Metabolic acidosis. Metabolic acidosis is a condition in which too much acid has become accumulated within the body. This could be caused by a variety of reasons such as the following: a buildup of bodily toxins or an injection of drugs. I would like to take a moment and look at the image on the right-hand side. Please note that 7 is neutral. This is freshly distilled water. I believe blood is at 7.4, which is what we like things to stay around. What I would also like everyone to look at is the carbonated beverages. They are very acidic, and in modern American lifestyle, we happen to drink a lot of that carbonated beverage. So continuing on. Metastatic acidosis continued. Metabolic acidosis is a common feature associated with the tumor's microenvironment and may promote disease metastasis. Acidosis has been shown to increase cellular activity of the cancer. Research conducted by Renneman showed that this activity persists for 3 hours after the tumor is transferred back to a pH of 7.4. This means that after a person or anything is introduced to an acidic environment, it takes some time for it to return back to normal, even after being dipped back into a wonderful 7.47 alkaline environment. Socioeconomic status. Socioeconomic status may play a large role in the treatment of cancer. According to the Centers for Disease Control, cancer is actually the second leading cause of death within the United States. As we have previously discussed, our nation is also experiencing an increase in individuals over the age of 65. A predominant amount of our elderly citizens utilize and rely solely on Medicare services, Social Security benefits, and these services do not always have the best interests of the patient at heart. They look more at the economic benefit. For that purpose, there are different treatment options in regard to cancer. Medicare will cover certain components of chemo, radiation, surgery. They will opt out of non-conventional or alternative methods, even if there is proof that some of them may work, or they go along with the guidelines provided to them by the Food and Drug Administration. So there is a lot going on when we're talking about the social and economic status of cancer and how it affects the different components of life there. Research has shown that those who are considered to be low in social economic status have more difficulty paying for treatment and medications. They also struggle in maintaining important office and follow-up visits. This is due to the fact that they must work. If they're low in the socioeconomic status, they don't have a lot of income coming to them. They're relying on Medicare, Social Security. They're looking for help in getting treated and also maintaining their normal life and being able to provide for their families and have food and normal necessities. So in conclusion, the biopsychosocial model is applicable to the diagnosis and treatment of cancer. There are biological components associated with the diagnosis and progression of the disease. Inflammation is a major factor affecting the metastasis of cancer. There are many psychological implications associated with the diagnosis of cancer that need to be carefully monitored and addressed. Positive social support is an excellent buffer against the negative emotions associated with cancer. I do state that further research is needed to understand the full economic impact associated with cancer and the impact that has directly on the patient. These are my references here, and I would like to thank everyone who watched this video. Thank you so much for sitting through this presentation with me.